highly technical, strictly regulated field like medicine and give it the visual polish of a Hollywood blockbuster without, breaking the law? Well, let's dive right into this explainer because today we're bridging that massive gap between high-end cinematic production and the incredibly strict ethical rules of medical communication. It's a pretty serious tightrope walk, right? You obviously want to captivate your viewers with these incredible cinematic visuals, but the literal second you cross the line into unethical advertising, you've lost. So producing a truly stunning medical documentary or clinic promo means you have to master both the art of the camera and the uncompromising integrity of medical regulations. So, here's our roadmap for this explainer. We're going to cover shooting the perfect interview, directing non-actors authentically, cinematic color and polish, crafting 3D medical animations, and finally, ethical medical communication. Okay, let's jump straight into part 1, shooting the perfect interview, which is absolutely the foundation of all of this. Look, before you even think about touching a light switch, you need to turn your camera into a literal data gathering machine. By shooting in 4K using a super flat color profile like S-Log3, you're essentially capturing a digital negative, and that gives you massive flexibility later on. You'll want to lock your shutter speed to 1/50th of a second to perfectly match a 25 frames per second base. Dial your white balance to a daylight matching 5600 Kelvin, and definitely throw a variable ND filter on the lens for really quick exposure tweaks. And that 24 to 70 millimeter lens, it's completely versatile. It's perfect for capturing a standard 40 millimeter medium shot, and then you can seamlessly push into 70 millimeters for those really tight emotional moments. Now, to actually shape your subject and bring that digital negative to life, you're going to want a solid 3-point lighting setup. Place your 5600 Kelvin key light opposite the camera. That gives you really nice dramatic facial contrast. Then, gently lift those shadows with a 17% intensity fill light on the camera side, which keeps things moody but super clean. You'll add a slightly warmer 4000 Kelvin backlight to separate your expert from the background. And here's the absolute secret weapon. Hit the background wall with a defocus projector displaying a gobo pattern. It completely breaks up a boring, flat clinical wall and gives the whole room incredible depth without distracting from your subject. Moving right along to part 2, directing non-actors authentically. Basically, keeping it real. There is a core philosophy you really have to adopt here, and it's this: the best acting is no acting at all. I mean, real doctors and patients aren't Hollywood stars. They can very easily look like a deer caught in the headlights when you point a massive cinema lens right at them. Your actual job as a director is to strip away the performance so they can just be a comfortable version of themselves. So if you want to avoid that stiff, rigid look, throw standard Hollywood protocols right out the window. Seriously, drop the clapperboard and stop yelling action and cut. Instead, borrow Clint Eastwood's subtle method. Just softly say go and stop. Keep your crew and equipment footprint incredibly small to reduce the pressure in the room. And please, instead of handing non-actors heavily scripted lines that they're just going to nervously recite, have a real natural conversation with them. If they freeze up, try the Meisner technique. Have them repeat your questions back to you as part of their answer to loosen up their vocal cords. You want to guide them subtly so every movement feels like it was entirely their own decision. Alright, part 3, cinematic color and polish. Let's take a look at the post-production pipeline. Straight out of the camera, your log footage is going to look pretty gray, dull, and lifeless. But hey, don't panic. That is exactly what you want, because it holds all the dynamic range. The very first magic trick in the edit bay is using a color space transform. Think of it as a translation process. It takes that flat, data-rich profile and converts it into Rec. 709, which is the standard, accurate color space used to display video on phones and TVs. This makes sure there are no weird color shifts when your audience finally hits play. And this sequence, it's basically a science. After your transform brings the footage into DaVinci Wide Gamut, you use primary color wheels to balance out your contrast and your white balance. But here is a massive pro tip specifically for medical videos. Use your color tools to actually reduce the density and saturation of the skin tones. Skin that is overly saturated can inadvertently make your expert or patient look flushed or even unwell, and you definitely don't want that. Once you nail that natural skin look, you drop in a cinematic LUT, like a classic Kodak 2383 emulation, and then you sprinkle in organic film elements like grain, halation, and bloom. Next up is part 4, crafting 3D medical animations, or visualizing the unseen. Because let's be real, sometimes the camera simply cannot capture the crazy intricacies of cellular biology or complex internal surgeries. That is exactly where high-end 3D animation agencies like Voca step in, and the sheer amount of work required here is staggering. It all starts with intense anatomical research, literally studying actual MRIs and CT scans. From there, storyboards map out the cinematic pacing. Then the artists dive into building precise 3D geometry and texturing to perfectly replicate real tissues and bones. Once those models are built, animators bring them to life using fluid dynamics and shape keys to simulate things like blood flow. And the final step is rendering all those textures and virtual lighting to look flawlessly realistic. Just imagine spending weeks, literally weeks, animating a complex sequence, only for a surgeon to take one look at it and point out that the cellular structure is entirely wrong. Boom, you've just burned a massive amount of time and budget. Early validation with medical experts isn't just a nice extra step, it is your ultimate safety net. As seasoned production managers will always tell you, the most costly fixes happen when those foundational modeling details are overlooked. Which brings us to our final section, Part 5, Ethical Medical Communication. Basically, playing by the rules. Now, this is where your cinematic ambition crashes headfirst into strict legal reality. Guidelines from governing bodies like the Malaysian Medical Council dictate exactly how registered practitioners are allowed to share information publicly. These rules govern everything, from a simple local clinic brochure all the way up to a 4K animated masterpiece on social media. And they prioritize public health and professional integrity way over profit. The rules here are completely black and white. You absolutely can share evidence-based scientific health information, but you definitely cannot make unsubstantiated claims or promise miracle cures. You have to fiercely protect patient privacy, which means absolutely no photos without explicit, documented consent. You should always identify yourself clearly and transparently using approved clinic signage, but you cannot advertise for direct financial gain, and you certainly can't go around claiming to be the best or the only specialist in your field. The focus has to strictly remain on education. The council makes one thing absolutely crystal clear here. Medical practice is not a commercial transaction. Any direct or indirect canvassing to promote personal advantage is strictly prohibited. So the very moment your beautiful documentary crosses that line from an educational tool into a flashy sales pitch for a specific procedure or some unverified product, you violated professional ethics. Ultimately, the most powerful medical content out there doesn't just look visually stunning. It actually builds profound, evidence-based trust. So, as you plan your next production, I want to leave you with this question. Are you using the camera to simply sell a service